Seaside was conceived with the idea of being a slightly different outpatient surgery center than the multiple ones that are already here in Naples and across Southwest Florida. Outpatient joint replacement has become more the established way to do younger people's joints across the country.
My name's Don Ulencott. I live here in Naples, Florida, and I'm a handyman. Basically, I had a lot of back pain. We thought it was all due to back issues, and because I had like sciatic and also a bulging disc. And then we started looking into it more and more and found out when we finally took an x-ray below the hip that I had a problem with my hip. Basically, it was bone on bone, and it was time to get that taken care of.
So the underlying premise under which Seaside was conceived originally was to focus on outpatient joint replacement, that being total hip, total knee, and total shoulder replacement. If you have a young, healthy person, there's no real benefit to staying in the hospital for extended periods of time. We get people in real good shape before surgery. They can go home the same morning and benefit from being at their home recovering rather than in a hospital setting.
My brother had the same surgery 2.5 years ago, and he had it done on the front side, and he said that's the way to go. And then my oldest brother 2 weeks ago had his right hip replaced also. So obviously it's a family thing.
You have the distinct honor of being the first patient in Southwest Florida to have same-day outpatient total hip replacement here at Seaside Surgery Center.
Went home with a walker. That night, a nurse showed up at the house just to make sure everything was good, everything was going well. The nurse did show up again for the next 5 days. PT came in the next day and started working with me at home.
We do the normal arthroscopy of joints, shoulder, rotator cuff repairs, foot and ankle surgeries. So many of the normal traditional outpatient surgery procedures are done here, but the unique feature of this institution is the ability to do joint replacement surgery here.
I've had 3 knee surgeries that were all golf injuries. I was afraid of, the surgery would interfere with the game of golf and I'd be out of golf and da-da-da-da-da. Not good thinking. Maybe sometime in late October, I did some silly little move, a nothing type move, and boy, it swelled up and hurt. Now that hurt. Before it was just discomfort, that hurt. I walked stiff-legged apparently, so I learned to walk in a way that wasn't, that I could minimize the discomfort. Or if I was going to go down steps, like say we went to, I don't know, it was one of the Egypt, or we do a lot of traveling with a lot of these old ancient stone steps, and I'd have to look at the steps and then make up my mind how I'm going to go down, squat so I could take the load on my thighs and squat down to keep it from hurting. So I would learn to compensate for that. So I called Dr. Zaire, and one thing led to another, and now I have a striker knee. I didn't know it was a round knee. That's spherical, isn't it? I'm very happy with it. I don't have a lot of basis for comparison, of course, because this is my first knee, but this was a smashing success as far as I'm concerned.
The operating rooms are much larger than your garden variety outpatient surgery center. In fact, they're at least as large as the hospital ORs that I work in now. So we have all the equipment that's here. We have the high-level anesthesia, good pain management techniques. We have all of the staff here are dedicated just to take care of a patient. We don't have 15 patients all going to the OR at one time. We have 1, 2 maybe. So with our abundance of staff, we're able to take good care of you as a patient and focus just on your recovery. We don't have to worry about bouncing around between multiple patients. And I think that's probably sets us apart from the other surgery centers in the area, and certainly in Southwest Florida, where I don't know anybody else doing outpatient joint replacement surgery.
You feel so much better, and I think you recover a lot faster. I was back to work within 2.5 weeks.
My golf game needs improvement. Putting is not so good. The chipping all the finesse part is not so good. I can drive the ball further. I think it is the knee, because before I would drive, and I'm always aware I was going to get a twinge. Not a pain, but I'd feel it. So you get a little, you hold back a little bit. That doesn't happen, which is kind of surprising. I've told many, many people that it's not really all that painful. At least it's uncomfortable having it, but it's not really pain, I don't think. And if you think you need it, do it. Do it.